Good morning, soon-to-be dental graduates. This is Dr. Robert Margolin, Director of the General Practice Residency Program at Jacobi Medical Center in the Bronx. Thank you for giving me the opportunity to talk to you today about our program and why you should consider Jacobi as the next step in your dental education. I'm going to speak with you briefly, and then I'm also going to give you a tour of the clinic, and hopefully I'll get to see you later in this year as interview season begins. Jacobi was a program that I graduated from as a resident many years ago, and at this point in my career, I'm very happy to be able to assume the title of program director here. It's a place that's very close to my heart. I've made a lot of close personal and professional contacts here over the years, and I've been able to take this now into the next phase, and hopefully that you will also consider this as your next opportunity as well too. Why should you choose Jacobi Medical Center as the dental GPR for you? First of all, this is a very vibrant and busy program. We see a large number of patients. There's a great emphasis on patient care and resident education here. We have multiple training programs: pediatric dentistry, dental anesthesia, and oral and maxillofacial surgery. Because the oral surgery program is here too, they place a tremendous amount of implants, which gives you, as a GP resident, an amazing opportunity to restore a large number of implants. You will also be able to place implants with the OS residents too, which is also a unique opportunity you'll have here. In addition to that, you have the opportunity for perio procedures, including perio surgeries, molar endodontics with rotary instrumentation and vertical obturation, advanced crown and bridge, and you'll also see pediatric patients too. We also do go to the operating room to treat patients that are medically complex or with developmental disabilities, so you'll get the opportunity to do that. And as with most programs, you have a rotation in emergency medicine and anesthesia. I'm sorry, I'm going to take a brief look at my notes here so I don't forget anything. Why should you consider Jacobi? This is a very supportive atmosphere to work in. We have a very small but dedicated attending staff here. Most of them are here 3 days a week. I'm here full-time. We have assistant program directors here full-time. They've been here for a long time. There's very little turnover in attending staff, and they really are very dedicated to resident education, patient care, and to your learning. They don't have patients that they see themselves here. They are 100% dedicated to your knowledge base improvement and to your education. Some of you may be wondering, what have we done here to prepare for COVID and for patient and staff safety? It's a great question. First thing we did was took chairs out of the waiting room, so we have a much reduced area out there. Patients now, when they come, if we have no chairs, leave their name and cell phone number, and they're texted when it's their time to come into the clinic. We also give all patients a pre-appointment screening, including a temperature check when they arrive, a travel history, and asking them about illnesses in the past 2 weeks. Anybody that we suspect might be ill, we have them see their PCP that day and return for dental care on another day unless it's emergent. We also have in every room air filtration units, and we are awaiting extra oral suction devices as well too. What are the qualifications you need to apply to Jacobi, and what are we looking for? Well, definitely you need to be able to graduate from a United States or Canadian dental school. You need to have passed both parts of your national board dental exam or taken the INDBE, which I know is starting in August of this year then too. I will definitely look at letters of reference, and for me here at Jacobi Medical Center, I also am very interested in what extracurriculars you have. I'm looking for a well-rounded doctor. Interviews will be offered in November, December of this year, depending on your location. You guys are in a New York school, we'll be offering interviews here live. If you're somebody applying from outside of the Northeast, most likely interviews will be done virtually. I'm going to take you now on a brief tour of the clinic, and at the end of that I'll give you contact information about the program and for myself. So let's go on the tour.
Good morning, this is Robert Margolin taking you a tour of the Jacobi Hospital Dental Center. This is our waiting room. You can see here we've taken a lot of chairs out for COVID. Right now it's every other chair, just have social distancing. There's our TV, so a lot of times we have educational videos on that. And I'm going to take you on a tour through the whole clinic now. So come with me. Here's our front desk area. You can see here too, once again, we have plexiglass installed for safety of staff and patients. And we're just walking around. This clinic is built in a big U shape. So I'm going to take you through one of the doors here with my ID card. There we go. And now we're inside the main clinic. So you can see down this corridor right here, we have our oral surgery side, and we have an orthodontic fellowship which operates out of here. Most of the operatories are set up the same way. See, we have lights, Cavitron, computer screens and everywhere. Actually, double computer screens for patient education as well too. Every room has an x-ray head. And we're down here now. It's one of our surgery suites. See, we just got these new lights installed, OR type lights, which make it a lot easier for surgical procedures. We're back in the hallway now, making the rounds, coming down the first side of the clinic. We just passed our in-house lab where you can do any models, wax-ups, and things like that. Here we usually have our oral surgery residents and attendings sit. See, they have skulls. This is where they have also access to scan images, to do surgical planning for cases too. And this right here is our ScanX machine where we develop our digital x-rays. This is one of our OR suites right here where we do sedations. This right here is our recovery room. Let's go in here for a second. Turn the light on here so we can see that. Oh, problems with the lights, but that's okay. This is where patients come to rest after their surgical procedures, which we do a lot of here in the clinic. Back in the hallway, this is one of our sedation suites. You see we have an anesthesia machine here. Do a lot of pediatric and adult sedations in here, PO and IV for advanced surgical procedures. Do a lot of implant placements under IV sedations. And as GP residents, you will get to take part in those. Alert, sorry about that. This is our small staff lounge area too. We have a fridge here where you can keep food. People eat lunch here in one of the other areas we have in the hospital. And right here on the board, you can probably see Who Am I? This is a remnant from our holiday party where everybody sent in a baby picture and put in guesses of who everybody was. Going down through the clinic again, you can see we have 2 video monitors, another ScanX machine. This is our iCat machine right here. All patients who are getting implant placements or deeply embedded third molars get an iCat. We send those scans out to Anatomage if we need a surgical guide for implant placements. And coming down the main corridor again, the other side, this is more of our GP and pedo side. I just want to show you again how the operatories are set up. These have been recently redone, and actually in the next year we're planning on getting new chairs. So hopefully by the time you get here, or at least partway through the year, we will have new chairs. You can also see on the floor that big blue machine is one of our filters that we use for air filtration. Again, after COVID, one of the infection control measures we put in place. Here's our computer, and you can see that we have the Dentrix system set up. Everybody is set up a different column, a different name. And here and at NCB, our sister hospital, the computer system is networked, so you can check charts from NCB here, and you can check charts while you're at NCB for Jacobi. And lastly, we have here our Panorex machine and our blood pressure thermometer right here. All patients, again, for COVID screening are getting temperature checks daily, as is the staff. And here's my office right here. It's going to be the last stop on our tour. You can see I'm all set up here. I like to be kind of neat and organized, so that's what you're seeing here. Just a tour of the office. I want everybody to take a minute and look at this. This is a paint by number I did of a starry night during the Corona lockdown in the beginning. Hopefully I'll have more by the time you get here. And that's the end of the tour. I'm hopefully you enjoyed it and are interested now in getting more information on Jacobi Dental GPR. If you would like to get more information, here's our website. Please feel free to check that. And feel free to contact me, robert.margolin@nychhc.org, or my number, 718-918-3864. Hope you had a good time and enjoy the rest of your day, and hope we'll see you soon. Take care. Bye-bye.